see about anesthetics. Okay, what are anesthetics? General anesthetics and local anesthetics are there. Okay, so let us first see what is anesthesia. Anesthesia is nothing but absolute loss of sensation. Okay, that means we will not be having any sensation. So there are two types of anesthetics, general anesthetics and local anesthetics. General anesthetics produces loss of consciousness and therefore loss of all sensations. Okay, sensation of all the will be closed. Okay, local anesthetics, when applied to the peripheral nervous system, blocks nervous conduction and abolish the sensation in that particular part supplied by the nerve without loss of consciousness or impairment of vital central cardiorespiratory function. So local anesthetic means its action is only to that local nerve where it is working. General anesthesia means complete loss of sensation, complete loss of consciousness. Local anesthetic means only the loss of sensation of that particular part. Okay, there is no complete loss of consciousness or no impairment of vital cardiorespiratory function. So, no loss of consciousness is local anesthetics. Okay. So, this is the stages of anesthesia. Anesthesia, initial condition is patient is awake. After giving anesthesia, the patient will go to the unconsciousness or loss of sensation and then surgery commences. Again, after loss of anesthesia effect, so after the patient will generally come from the unconscious or loss of sensation state to the awake state. Okay, so stage 1 is analgesia, stage 2 is delirium, stage 3 is surgical anesthesia, stage 4 is respiratory paralysis. Here I am not going much deeper into this pharmacology and details. Okay, we see what are the drugs that are responsible for anesthesia. Okay, and their structures and important points. So what is the classification? Classification of general anesthetics. General anesthetics are classified into different types: volatile anesthetics and intravenous IV anesthetics. Volatile anesthetics means any gaseous substances. Halogenated examples. Okay, halogenated hydrocarbons and ethers. Okay, these are volatile anesthetics. Ethers and hydrocarbons, halogenated hydrocarbons. And examples are halothane, enflurane, isoflurane, desflurane, sevoflurane. So halogenated, that means halogen, fluorine, ethers or hydrocarbons, just carbon and hydrogen. And volatile liquid, example methoxyflurane. Volatile liquid anesthetic, general anesthetic is methoxyflurane. Then gas, cyclopropane and nitrous oxide. Volatile gases, nitrous oxide, cyclopropane. Volatile liquids, methoxyflurane. These two are examples for volatile general anesthetics. Next, intravenous anesthetics. Intravenous anesthetics are again divided into different types: barbiturates, benzodiazepines, opioid analgesics, aryl cyclohexamines, miscellaneous. Examples: barbiturates are thiopental, methohexital, hexobarbital, thioamyl sodium. Benzodiazepines, example diazepam, midazolam. Diazepam and midazolam are benzodiazepines. Barbiturates. So intravenous anesthetics: barbiturates, benzodiazepines, opioid analgesics. Okay, barbiturates examples are thiopental, barbitals, hexobarbital, thiopental, methohexital, thioamyl sodium, etc. Benzodiazepine examples are midazolam, diazepam. Midazolam and diazepam are benzodiazepines. Then opioid analgesics examples: morphalin, fentanyl, sulfentanyl. Fentanyl is all morphine, remifentanil. And another example is propofol. Aryl cyclohexamine is ketamine. Miscellaneous: droperidol, etomidate, dexmedetomidate. Okay, I will show you the structures of all these drugs. Just remember the classification of volatile anesthetics and intravenous anesthetics. Volatile anesthetics examples are divided into ethers and halogenated hydrocarbons. Ethers and halogenated hydrocarbons. Next, one important point is volatile liquids examples, volatile gases examples. Volatile liquids are methoxyfluorine, volatile gases are cyclopropane and nitrous oxide. Volatile gases are nitrous oxide and cyclopropane. Methoxyfluorine is volatile liquid. And again, intravenous anesthetics are divided into barbiturates, benzodiazepines, opioid analgesics, aryl cyclohexamines, and miscellaneous examples. Barbiturates examples: thiopental, amylal, thioamylal, hexobarbital, methohextol. Benzodiazepines, diazepam, midazolam are intravenous anesthetics. Benzodiazepine anesthetics. Opioid analgesics: fentanyl, remifentanil, efentanil, sulfentanil, morphine. Opioid analgesics. Aryl cyclohexamine is ketamine. Okay, aryl cyclohexamine is ketamine. Now we will see mechanism of action. Three important points are there in the mechanism of action of this general anesthetics. They target the ligand-gated channels. Okay, ligand-gated channels, the transmission is targeted. So, GABA receptor gated chloride channels. GABA receptors gated chloride channels. GABA receptor gated chloride channels. These are the important sites of action, and they perform the inhibitory action. So, there also this anesthetics will act. Ligand gated channels, that too GABA chloride gated channels. Then nitrous oxide and ketamine do not affect the GABA or glycine gated chloride channels, but they act on excitatory NMDA type of glutamate receptors. The rest of the drugs act on GABA or glycine, whereas ketamine and nitrous oxide act on NMDA. Okay, NMDA receptors, which belongs to this. GABA is chloride gated channels, NMDA calcium gated channels. Okay, this is inhibitory action, this is excitatory action. So, anesthetics will act, will target these gated channels. On GABA gated channels, rest of the except nitrous oxide and ketamine, rest of the general anesthetics. Nitrous oxide and ketamine on calcium gated NMDA channels and leads to the neuronal hyperpolarization. So, this is the mechanism of action. So, examples of volatile anesthetics are chloroform, halothane, enflurane, nitrous oxide. Okay, all these are examples, and important points. Chloroform, important point is its side effects. Chloroform is having all side effects like CNS effects, CVS effects. Okay, carcinogenicity, nephrotoxicity, hepatotoxicity. Halothane is non-inflammable and non-flammable and non-explosive. Enflurane is also non-flammable. And enflurane relaxes the uterus, and thus it should not be used as anesthetic during labor. Okay, during labor, if you give enflurane as an anesthetic, it will relaxes the uterus and it will not causes these contractions. That's why it is not given during labor. Nitrous oxide is a drug of choice for dental surgery. For dental surgery, nitrous oxide. Okay, these are the important points about volatile anesthetics. So, these are the structures. If you see the structures, halothane, so how many carbons are there? 2 carbons are there. Ethane, how many fluorines? 3 fluorines on 1 carbon, chloro, bromo. So, 1 carbon, 1 trifluoro, 2 bromo, 2 chloro, ethane. It is halothane. Halothane consists of 2 carbons. It is a ethane molecule. On ethane, trifluoro, 1 trifluoro, 2 chloro, 2 bromo. 2 bromo, 2 bromo, 2 chloro, 1 trifluoro, ethane, that is halothane. Next, enflurane. This is enflurane. So, it is an ether, okay, ether containing substance. So, this is also trifluoroethane. 1, okay, first is 1, 2. 2 chloro, 1 difluoro, 2, this is 2 chloro, okay, 2 chloro on 1 difluoromethoxy, 2 trifluoroethane. That is enfluoroethane. This is halothane is not an ether, whereas other enflurane, isoflurane, desflurane, all are ethers. Sevoflurane, all are ethers. Okay. So, here the name is 2 chloro, okay, 2 chloro on 1 difluoromethoxy, 1, 1, 2 trifluoroethane. Isoflurane, only the substitution on hydrogen or fluorine is different. Desflurane, methoxyflurane, sevoflurane, cyclopropane, ether, diethyl ether, nitrous oxide, all these are examples for general anesthetics. Except halothane, all others are ethers. Next, important points, propofol. What is a propofol? It is a active, it acts via enhancing GABAergic neurotransmission. Name of this propofol is diisopropyl 2,6 diisopropyl phenol. This is propofol, which is used as general anesthetic. Propofol is used as a general anesthetic. Okay, 2 isopropyls, diisopropyl. Okay, 1, 2, 3, 4, 5, 6, 2,6 diisopropyl phenol. Okay, that is propofol. Phosphopropofol is a phosphate ester prodrug of propofol. Okay, prodrug of propofol is phos-propofol. Ketamine is recovery from anesthesia can be accompanied by emergence delirium, which is characterized by visual, auditory and confusional illusions. So, after recovery from the ketamine anesthesia, okay, delusions and delirium is visible with the ketamine, propofol. Okay, etomidate is a imidazole containing drug. Okay, name itself indicate here, etomidate, imidazole. It is an ester of carboxylated imidazole, positive allosteric modulator of GABA receptor. This is also GABAergic, this is also GABAergic. Propofol is a isopropyl group will be there. Etomidate, imidazole, carboxylate group will be there. Carboxylated imidazole. Thiopentol is a ultra short acting barbiturate. Thiopentol is a ultra short acting barbiturate.